young guys in their 30s, they're getting strokes.
People undergo a lot of neck massages at their barber shop, and that can cause what we call as a dissection of the carotid artery. So a lot of strokes are happening because of these reasons also. Hypertension is a silent killer. You have no symptoms for hypertension. Suddenly there's a burst and you have a hemorrhage inside the brain.
There are many people you hear, हम तो रोज सुबह योगा करते हैं, वॉक के लिए जाते हैं, फिर कैसे स्ट्रोक हो गया?
Doing yoga doesn't say that you will not have stroke. And if you have hypertension, how will it help? You have to take medicines for hypertension. You have to take medicines for diabetes. You have to take medicines for lipid. And if you have a heart condition, how will yoga save you? Yoga is good, but it is not going to prevent a stroke.
Environmental factors, air pollution.
Besides other diseases like lung diseases, dementia has been found that places where there is increased amount of particulate pollution, you get dementia.
Parents talk about that school-going children, recreational drugs is very common now.
Cannabis can cause strokes, well known. It can cause headache, lung problem, it can cause cardiac problems. This is well known.
Party drugs?
Absolutely no. There's nothing like a party drug. It is all being pushed as a party drug.
Are you seeing a trend of youngsters coming to you with party drug-related strokes?
Once in a week, we see a patient, a young boy, 20 years, 30 years, with a party-related stroke.
Can brain cells grow back once they die?
Never. This is the saddest part. So if a stroke happens, a particular part of the brain is dead, it remains dead.
Is the government doing enough? Should we have more spent on research on neuroscience?
Deep down in the hinterlands, epilepsy is still being treated by jhadpuk. Stroke management is done by putting turmeric and all that in the villages. No, that has to be stopped. The cost of treatment is so high. There has to be a cheaper, more meaningful health insurance policies for the individual. I think that is what is required.
This episode is powered by easemytrip.com. Namaste Jai Hind, you're watching or listening to another edition of the NI podcast with Smita Prakash. India records 18 lakh brain strokes a year. My guest today is Dr. Dev Mukherji, neurologist, Vice Chairman and Head of Neurology at Max Super Speciality Hospital in Saket, New Delhi. He served for 23 years in the Armed Forces Medical Service and at the Army Research and Referral Hospital in Delhi. The conversation today is about why frequent brain strokes are happening. India records a brain stroke every 20 seconds. How to recognize it early, like sudden weakness, difficulty in speaking, or loss of vision, and what to do about it. Thank you, Doc, for coming to the podcast. Today, Doc, I want to talk to you about the rising cases of strokes which are happening. The latest I've read is that 18 lakh new brain strokes every year in this country. So I want to know that what is it and why is this increase happening? If there is a something that is to be concerned about, and it was seen that strokes was something which the elderly had. In our office itself, now we've had cases where young guys in their 30s, they're getting strokes and stuff like that. So why is this happening for people under 40s? What should we look out for? So if you could give me a little bit.
First of all, thank you very much for giving me this opportunity to talk to you. See, stroke has always been the number 3 killer in the country. Okay. And it is the worst thing about stroke is that it causes a lot of disability and mortality as well. So stroke needs to be seen as an emergency always. Now, the classical causes of stroke were hypertension, diabetes, smoking, sedentary lifestyle, lipids. These were the earlier causes. But there are new causes which are coming in young stroke. We have something called young stroke in young, which is less than 30 years, 40 years, like that. Now, there we are finding that there are many other things which are causing it. For example, there is a blood component called homocysteine. Rise in homocysteine causes clots, clot formation. Then there are other procoagulant factors. Procoagulant factors means those which promote coagulation in the blood vessels. Now, there's protein CS, protein C, protein S deficiency, and apolipoprotein. All these can cause clots in the brain. Now, these were not identified earlier, and now we are identifying them. These are newer risk factors which have come in. Then there may be a small hole in the heart which has not been detected earlier. We found that many people have that. There's called a PFO, perforated foramen ovale. That can also cause a lot of stroke. Then the sedentary lifestyle and also neck massages. I want to highlight this. People undergo a lot of neck massages at their barber shop, and that can cause what we call as a dissection of the carotid artery. What happens is the artery has got it's got a wall. Now if there is a breach in the wall, the blood enters that wall and there's no blood supply distally. That means upwards towards the organ. So that can also cause stroke.
Plus, you don't get to know when the massage is happening?
You get to know, but by the time this happens, there is that
Not
we
enough.
can get to know because we take the history properly. So a lot of strokes are happening because of these reasons also.
Okay.
I think there are a lot of youngsters who do gym and they think that we are fine, but their lipids may be awfully bad.
Yeah.
They may be smoking, even vaping, hashish. All these are risk factors for stroke. They may not have been well documented, but we are seeing them every day. Okay. Young people, you are very right. Every day we see 30, 40 years age group coming with strokes.
Yeah.
Yeah. Even while gymming, they may have a dissection of the aorta.
Yeah.
So,
You know, one of my cameramen, he was interviewing a cardiologist talking about heart conditions and happening, and suddenly he just fell. And he'd had a brain stroke while he was doing the interview. You know, so, and young guy looked very fit, but obviously something must have been wrong, which happened. So I want to get this when you talk about lifestyle problems, like you're saying sedentary work, not realizing lipids, stress factors. How is one supposed to figure out that, okay, I am heading towards this problem area? Where should one watch out for?
So all the risk factors should be done away with, like smoking, alcohol, excessive alcohol. People take a lot of alcohol now. So alcohol, smoking, sedentary lifestyle, and good vegetarian diet, and avoid all fatty food. All this must be completely eliminated from your day-to-day life.
Most vegetarians think that they are very healthy.
No, but if they take fatty food, then the purpose is defeated.
Yeah.
So they have to be you have to do mindful eating.
Okay.
Mindful eating is eating the right thing at the right time and in time. Then work-life balance. People are partying till late in the night and early morning they have stroke. The other thing which I just wanted to allude was that hypertension. Hypertension is a silent killer. You have no symptoms for hypertension. Suddenly there's a burst and you have a hemorrhage inside the brain. A lot of people are going through this. So that also contributes to the mortality and morbidity of stroke. So stroke, as I said, were two types. One is the ischemic stroke and one is the hemorrhagic stroke. The hemorrhagic strokes are where there's a bleeding which happens because of the rupture of an artery. And ischemic stroke is when there's a clot within the artery and there's further blood supply is delayed or stopped.
Okay. But in which case is it that one doesn't have time to see the reactions?
So in ischemic stroke, where there is a clot, we have to reach the hospital within 4.5 hours because that is the time where we can thrombolize that stroke. Most people take a very slower route. Either they go to the local physician or they go to the local doctor, and as a result, what happens is timely help doesn't come in. Then there is something called wake-up stroke. Now this is an interesting thing which I'll tell you. People went to sleep normally, but they wake up with stroke. They can't speak and their one-sided is weak. Now those patients, earlier we were saying, no, we can't do anything. But now we have a special imaging technique in the MRI, which we call as the flare. If the flare is negative for stroke, we thrombolize them. Then those strokes which happen in the back of the brain, which we call as posterior circulation stroke, we can, in certain selected cases, we can thrombolize them till 24 hours.
Explain thrombolize.
Thrombolize is basically a clot buster, which we inject within 4.5 hours for a normal ischemic stroke. And it can blast that clot which is causing the decreased blood flow to the brain. So that is very, very useful. And we also have something called mechanical thrombectomy, which we can perform up to 6 hours in a stroke.
Okay.
So if a patient comes well within the time of 6 hours or 4.5 hours, within 4.5 hours we will do thrombolysis, and within 6 hours we can do thrombectomy. Now thrombectomy is usually done for a large vessel obstruction. The carotid artery and the first vessel which comes out, we can do a mechanical thrombectomy. That means a catheter is put inside the brain. It goes up to the brain and you will suck out that clot. So all these developments have happened. To give you a rough...
Doesn't it damage the brain when you suck out a clot?
No, nothing. The techniques are very refined and advanced, and it is very, very great, and it is very, very gratifying.
Okay.
The problem, I'll tell you where the problem is. We get approximately 1,000 strokes in Delhi. That's a very rough approximate, but only about 10% of them get the proper treatment. The lack of information, the lack of education, the lack of knowledge that all this is amenable to treatment is something which is impeding our management of stroke.
a major problem is reaching the hospital on time, right? And convincing somebody that they need to reach the hospital on time. What is the process if, suppose, one gets to know that your sibling or your father or your mother is exhibiting signs of stroke? They should reach the emergency first, or they should seek an appointment with the neurologist. Please explain the steps to be taken.
If four things happen, like your speech gets disrupted, your face droops, and your arm droops, these are called the FAST. T is time. F is face, A is arm, S is speech, and T is time. Please reach the nearest emergency hospital, which is a big hospital where they do stroke work. And every physician today can do stroke management. Every physician, any MD medicine can do a stroke. He can at least diagnose it well. A CT scan is all that is required to diagnose a stroke. That means you look, there is no bleeding. You can give that clot buster yourself, or you can send it to the nearest hospital where this clot management can be done for strokes.
When you say you mean the emergency doctor?
Yes. They should not take an appointment. They should go to the emergency.
They go to
because the system will take care of it then.
Okay, let's get back to the lifestyle factors, Doc, because, I don't want to scare the audience, but I want everyone to understand that what are these medical factors, like you were talking about hypertension, diabetes, cholesterol. So what are the tests that one should do on a regular basis? Is it once in 6 months, once in 3 months? The age group that should do it more often, and when?
Anyone above 25 should do an annual medical examination. He should get his blood pressure checked. He should get his sugar checked. He should get his lipids checked. And this is to be done on an annual basis. And he should get his blood work done. Basic blood work should be done. That is his blood count. Supposing somebody has a hemoglobin of 18, he cannot get a stroke because the blood is very thick. That is called polycythemia. So that also, those kind of people also need to get their blood test done. So annual blood work, checking of blood pressure, diabetes is the basic minimum that should be done by every individual.
Okay.
And he should not smoke alcohol within limits. I think there's nothing like defined within what is limits.
Limit, yeah.
There's no definition for that. And all, high risk behavior should be avoided. Sleeping late in the night and partying till late in the night. All this disrupts sleep, and that can also ultimately can lead you towards stroke.
Yeah. And the other thing which happened was that, when those sudden stroke related deaths which happened with celebrities, and when I was speaking to, some of these trainers and all, and they were saying that क्या होता है कि ये celebrities जो हैं वो late night तक पार्टियां करते हैं, या इनकी meetings late होती हैं क्योंकि दिन में shoot करते हैं, उसके बाद meetings करते हैं, so they end up sleeping at 2 o'clock or whatever, but they book their gym trainers at 5 a.m. or 6 a.m. So which means that they have not slept more than 3 hours or 4 hours. They reach the gym because they have to, because bodybuilding is part of their, their requirement. It's their job. They have to look a particular manner. So with 4 hours of sleep, they book their gym trainers, they come and exercise, and very healthy people get their strokes, whether heart or brain, and collapse.
Say apparently look healthy, but they may be having blood pressure.
Yeah.
They may be having a cardiac issue. They have not got themselves investigated or, got themselves checked up in time.
Yeah.
So that's I think that is a factor which troubles them.
Also, genetic factors. If you could tell me that do genes play a role in strokes? Like one hears ki diabetes, virasat mein mili hai, those kind of things. What about strokes?
So genetics in stroke is not a direct relationship. They are multifactorial. Strokes, as I told you, these are multiple risk factors there. Directly, if my father had stroke, I will have stroke. That's not correct. So that doesn't happen. There are very rare conditions in which probably is not required to know, where you can get strokes. They are very rare. The Fabry's disease is there, for example. The artery itself is defective. That can run in families like that. But those are very rare. So stroke is not a genetic disease by and large for consumption of normal people.
Okay. Environmental factors, air pollution.
Big time. Air pollution has not been graded as a risk factor for stroke, but for dementia it is proved.
Okay.
Okay.
How is dementia related to stroke?
So exact mechanism is not known, but it has been found there is a statistical correlation.
Okay.
If there is air pollution, besides other diseases like lung diseases, dementia has been found that places where there is increased amount of particulate pollution, you get dementia.
How does that work?
Exact mechanism is still not elucidated, But probably what I can guess, it causes neuroinflammation, which leads to neurodegeneration, and that causes...
So pollution leads to inflammation of your neurological...
Yes, yes, yes. Well known. Well known.
I thought it's just lungs. How is it brain too?
It goes into the blood.
Correct.
It goes into the blood, and blood goes everywhere.
Yeah, okay. So what is one supposed to do? Because this is not in your control.
So, as I'm going to say, control your weight, control your blood pressure, control your diabetes, control your cholesterol, lipid. As of today, lipids are important. Control your exercise, have decent amount of exercise, walk every day for 30 minutes or 20 minutes. Don't smoke, don't drink too much. These are the simple precautions that one has to take.
But Doc, when there are many people you hear, हम तो रोज सुबह योगा करते हैं, walk के लिए जाते हैं, फिर कैसे stroke हो गया?
No. Doing yoga doesn't say that you will not have stroke. If you have a cholesterol, how will yoga help? And if you have a hypertension, how will it help? You have to take medicines for hypertension. You have to take medicines for diabetes. You have to take medicines for lipid. And if you have a heart condition, how will yoga save you?
So there's also
yoga is good, but it is not going to prevent a stroke.
There's also resistance towards medications which are lifelong dependency medication, in the sense that if you start hypertensive medicine for hypertension, it's something that you have to take lifelong, like insulin for diabetes. So we don't want to go on insulin. We'll try and manage our weight. We'll try and manage our sugars. The other thing is that, in India, lots of times the doctors, they have very sweet bedside manners. They suggest to the patient कि अब आपको insulin करना पड़ेगा. Now, many times what happens in India, I've noticed, is that older people have this thing, we don't want lifelong medication. Because then it's money first, that they have to spend that much of money. They have to tell their children that, itna paisa kharch hoga. They don't want that dependency on children. There are many factors which work. So, tell me, at what stage is it that it is ye janleva hai, you have to do it?
So, it's a very important question that you have raised, an important situation also, because there are certain diseases where you have to take medicines for life. For example, if you have hypertension, you have to take, more or less you have to take for life. If you have diabetes, you have to monitor your blood sugar. There's no way on that. If you don't monitor your blood sugar, you will have some complications. You will have a neuropathy or a retinopathy or a kidney failure or something like that will happen. So there is no escape from that. What is, I think, important is the financial part of it. That part of it is really beyond us. It is a part of the federal government to take care of that. There has to be an opportunity where these lifestyle diseases need to be managed lifelong.
Yeah.
So you have to take medications. There's no option I don't want to take.
Yeah.
Whenever doctor tells that you have to take insulin, that means there's a requirement. He won't tell you just like that.
Yeah, because diabetes now, they're saying it's like an epidemic in this country.
Type 1 diabetes, you require insulin every day.
Yeah.
And there are many type 2 diabetes who fail to respond to normal oral drugs, so they have to take.
And then it becomes a neuro issue or a cardio issue.
Complications happen. Diabetes can affect so many things. Yeah.
It'll become, that is the next stage.
Yes.
It will affect some organ or the other.
Yes.
You spoke about substance abuse, alcohol, doing soft drugs,
even drugs,
recreational drugs. Yeah. How serious is this now? Because I've heard parents talk about this that school-going children, recreational drugs is very common now. In my time, it used to be at college level that one heard about it or one saw it happening. But now it's at high school level in India. And in states like Punjab and in the Northeast and in Kashmir, it's commonplace.
So I will respond to it like this, that in no way can we justify using drugs. Unfortunately, it is become so rampant that it is getting a social acceptance, which is incorrect, absolutely harmful to the core. Any kind of drug will cause all kinds of problems. It can cause strokes, well known. Even cannabis can cause strokes, well known. It can cause headache, and it can cause lung problem. It can cause cardiac problems. This is well known. And people take it because it is being propagated by the powers that be, who are behind pushing these drugs, that it is good and it is harmless and all that. All that is being propagated. I feel there is an ulterior motive behind it. It is clearly, unequivocally, it is harmful.
And when you say powers that be, you're talking about Hollywood celebs and all that.
I will not like to allude to that, but whoever they are, I think it's wrong. It's absolutely wrong.
Party drugs, say no.
Absolutely no. Strictly no.
Yeah.
There's
Even if
nothing like
it's-
a party drug. It is all being pushed as a party drug. It is being colored as a party drug, as if it will enhance your some psychedelic mind or something like that. But I think it's absolutely wrong. It's dangerous.
It's, yeah.
Unequivocally dangerous.
It's just like, I think, drinking, which, you know, all the Punjabi songs and things like that was all about, oh, drink and have fun. And, you know, they made it socially acceptable to be. So you had all the top heroes doing a drunken scene for certain in every movie, which started off in the 80s. Till the 70s, it was not there. Your heroes were, you know, Mr. Goody Two Shoes, who never drank, didn't smoke. It was the villains who did that. But somewhere that changed. And when your heroes in the films are doing it, then it became acceptable to be drinking to be drunk. Not party drinking, but drinking to be drunk. And then we are seeing alcohol related issues. In Punjab, it's very serious.
Absolutely.
In this. So now tell me, are you seeing a trend of youngsters coming to you with party drug related strokes?
Yes, definitely. Definitely.
Okay.
I see maybe not too many of them, but once in a week we see a patient, a young boy, 20 years, 30 years with a party related stroke or a party drug related neurological problem.
Which is like what? A tremor or
Seizures, epileptic activity.
Okay.
When we do a urine screening, then we come to know he has been taking this drug.
What about energy drinks?
I think they are flashes. I don't think they give any energy. It is better to have normal khana pina, dal, sabji, roti. I think these energy drinks are basically commercial products which are being pushed by the commercial.
Are they dangerous?
I will not say they're dangerous, but I will say that they are really not worth it, the amount that we spend on it.
Okay. Let's get to warning signs, which all of us should know with regard to our parents, with regard to ourselves, and increasingly with regard to children also, those who have, if you're seeing it in dizziness and if you're seeing drooling, like you said. So tell me, how does one think of it that ye धूप की वजह से dizziness है? Or is it
So
stroke
about
related?
dizziness, I will tell you, dizziness has got three causes. One is a ear cause, other is a brain cause, and third is a cardiac cause. So as a doctor, I will like to delineate between these three things. Now the clue is that when it is related to a posture, a dizziness which is posture related. When I go to the left side, I get dizziness. When I go to the right side, it doesn't happen. Likely to be ear related. Basically, the connection from the ear to the brain is faulty. Now, let me explain this a little bit more. The ear has got three parts: the external ear, the middle ear, and the inner ear. The inner ear has got three canals, which are at right angles to each other, in which some fluid moves. Now, due to some reasons, there's a crystals are formed. Now, they drag the fluid beyond what it should be moving when you are moving your head. Now, that gives a false sensation of rotation to the brain. So, you perceive that you are having a dizziness. Now, certain strokes, those which happen to the back of the brain, they can also permanently cause this dizziness, but they are not. They don't change with the posture.
Okay.
They are fixed. Cardiac ones happen with palpitations, with some cardiac clot going up to the brain. That can cause.
How do you know that it's not vertigo and it's just...
Same. What this is dizziness, vertigo, giddiness. These are interchangeable terms
I see.
used by people interchangeably.
Okay. But it's like you keep hearing women, or it's wrong to say women, उनको चक्कर आता है.
So
सिर दर्द होता है, migraine होता है, एक तरफा pain.
एक तरफा is migraine.
Migraine.
By and large, it is migraine. There are certain rare conditions which can mimic migraine. But ek tarfa pain for a young boy, we will consider that as a migraine. Especially if there is no associated redness of eye. There are many conditions which mimic migraine. But migraine is typically one-sided headache, comes frequently. There are triggers, specific triggers, like you should remember the 5 C's. Coffee can
Okay,
cause...
I'm giving it down. Okay.
Okay, colas, citrus food, all this can cause a cheese and chocolate.
You just described my diet to me right now.
So all these called the 5 C's, they can manifest with migraine. Migraine is an extremely common disorder. Even I suffer from migraine.
Yeah.
And it is ubiquitous. You know, you see any youngsters having one-sided headache, you presume it is migraine. Of course, we do certain tests before we...
But how do I know that this migraine is just migraine and it's not
So this is a
stroke?
clinical judgment. Clinical judgment. First of all, it is intermittent. It is not a regular constant thing. It comes and goes. And it comes when you are hungry. It comes when you are sleeping late in the night. You are going to bright sunlight. Then it can precipitate migraine.
Yeah.
Okay, one-sided headache, throbbing, and you don't like lights. Then you don't like sounds. You want to sleep it over.
Smells bother.
Smells, yes. Strong odors can cause it. Perfumes, strong perfumes can cause it. There are many triggers. But some of the common ones I mentioned is hunger, bright sunlight exposure, and strong perfumes or strong odors. It could be a petrol, for example. The odor of petrol itself can cause. And you have to customize the treatment for the patient.
Everybody's is different.
Everybody is different.
So,
but there are a lot of new things which have happened in migraine.
okay. So when somebody complains of a headache, it's not necessarily a indication of a stroke, but watch out. Would you say?
See, the headache associated with stroke is very different. There you become drowsy, there is altered sensorium, there is confusion. That is called, like, there's a leakage of the or leakage from the artery, that is called subarachnoid hemorrhage. So that headache is like the worst headache of his life. But if somebody gets a slowly building up headache on one side, it is likely to be migraine. But it needs conclusive.
Okay, people with fluctuating blood pressure, they also have this dizziness spells and things like that. So how do we know that at that point of time, this is a serious situation and it's
So
like...
what I understand from what you're asking me is that is something called a transient ischemic attack or a postural hypotension,
yeah.
TIA. TIA is a small temporary stroke. Basically, the blood supply to that part got stopped and restored later on. Say after, officially it is supposed to be 24 hours, but within few minutes, if it gets restored, it's a TIA.
Because they slur for a few minutes,
Yes.
or they talk random things and then it comes back.
But that is very dangerous because that is like a sign for an impending stroke.
Oh, I see.
Yes, so they should be investigated thoroughly. Why it is happening? Does he have a risk factor? Is the arteries blocked? A small clot has gone from from the artery to a larger artery to a small artery, or a clot has traveled from the heart to the brain. So they are dangerous and they need to be looked into it.
So immediately go and get an MRI or a CAT
Absolutely.
scan or
Whatever the doctor decides.
Whatever the doctor decides. So TIA is not to be ignored as...
Not at all.
Okay.
A TIA requires the same treatment as stroke, but not the thrombolysis, etc.
Okay.
So that should be done.
And panic attacks, anxiety attacks, how are those connected with strokes? One would presume that it's connected with cardiac issue?
See, panic attacks and anxiety attacks are emotional issues, reaction to an emotional situation. They do not necessarily mean that there is a stroke happening. You can have a stroke.
Does it cause blood supply alterations?
It can raise your heart rate, it can raise your blood pressure, stress and stroke, but necessarily directly does not cause stroke.
Okay. Prevention and treatment. Let's get to prevention and treatment. You suggested lifestyle changes as a major issue. Sleep well, eat well, exercise, life balance. When should this happen? Work-life balance. When should one start disciplining oneself? Is it in your 30s? Is it in your 40s? And is it too late by your 50s?
At all times, at all age groups. You can't be disobeying your body. You have to respect your body. You must sleep 7 to 8 hours. You must eat green leafy vegetables. You must eat a lot of, you should avoid butter, cheese, etc. All this is very clear. It is at all ages. See, your arteries start getting clogged at 20 years of age, or maybe the time when you're born also.
Really?
Yes. Yeah. I mean, depending on what kind of food is there, starts getting deposited.
Okay.
So you have to take care of yourself at all age. By the time you're 60, 70, then it is already clogged. So we have to prevent it.
So what would you tell young parents? What kind of diet should they concentrate on with their children, especially preteens?
Green leafy vegetables are must. Absolutely must, because they have got antioxidants which help in improving the blood supply. They should not eat junk food. They should not eat this Ajinomoto type food. Junk food means like fried food and processed food. That's very bad. They are poison. I know the burger companies and the chicken people.
That's okay. They don't sponsor me. So go ahead and say whatever you want.
They may not like this.
That's okay.
They may put a dislike to this.
Frankly, I don't care. I want more people to lead healthier lives. So
Yes.
I'm hoping
So
that...
they are dangerous food. I will classify them as dangerous
People
food.
don't realize, and I put myself in that, I'm not trying to be holier than thou, that just adding ketchup, adding mayo to everything that they're eating street food never used to be that.
Absolutely.
Street food used to be freshly made imli ki chutney, freshly made hari chutney. No longer. Every street food now has cheese bhi lagao, mayo bhi dalo, or ketchup bhi dalo.
Ha. See, all these momos and other things, they come packed with all poisonous stuff, you know. I mean, I will not say poisonous, but they are unhealthy. They're very unhealthy. Like fried chicken, which is distributed and dispersed in bread and all, is all very dangerous. It's not good. See, if you once in a while, it's okay. But if you take it on a regular basis, it's dangerous.
Yeah. Which is happening pretty often
Very
because there are many parents who say that हमारे बच्चे खाना नहीं खाते जो हम बनाते हैं दाल सब्जी and all. And there's also the Instagram generation. They want to put pictures of their khana on every day basis, daily basis. So your dal chawal and all, it looks pretty messy and
Yeah, you're right.
So the prettier the food, so young mothers or whoever's cooking has to make that effort to make even the leafy vegetable look pretty.
Yes.
For that.
Yes.
So it's extra effort.
Yes. Fruits, fresh fruits.
Yeah.
People are not eating fresh fruits. You eat fresh fruits, you eat fresh vegetables. You can take chicken, you can take fish, you can take other than red meat, because red meat has got a lot of this thing. You can eat all that. Who has non-veg? Nobody's stopping from eating these food. You can take skimmed milk. All this is good for your health.
Okay, and you spoke about work-life balance. It's literally impossible. You know it. I mean, I don't think even you have work-life balance. I see you sitting in the hospital all the time. The pressures of work. It's modern day. Commuting is a major issue. People take anywhere between 1 hour to 3 hours commuting from home to place of work. How can they get rid of that stress at that time?
See, I think the answer again remains the same. These are standard protocols that you have to exercise a little bit. You have to take out time. 20 minutes time you have to take out to do exercise. Eat wisely and control your hypertension, control your diabetes, etc. These things have to be done if you have. And you need to sleep. People are not sleeping adequately now.
Yeah.
You have to sleep 7 to 8 hours every day. They are not sleeping that. I emphasize this 3-4 things: mindful eating, sleeping, because they are important for all aspects of life.
So if one is not able to sleep naturally, taking a pill to sleep, how harmful is that?
Very harmful. See, I'll tell you what are the dangers of not sleeping. So if you have insomnia in a short term, it will cause disruption in your neurotransmitters. But if you don't sleep for long period, there will be neuroinflammation. And neuroinflammation leads to neurodegeneration. This is a fundamental thing which you have to understand. Then you get forgetfulness, then you get memory lapses, then you become irritable, then you are all the time angry. Your decision-making process, your ability to understand, comprehend, analyze and judge are all impaired.
Okay.
If you don't sleep well. Maybe 1 day, 2 days I can understand. But on a regular basis, if you don't sleep well, this is what is going to happen.
Okay. Please tell me the difference between memory lapse and dementia. I'm getting into like my issues. Free में आप बैठे हैं तो मैं सारा अपना पूछ लेती
So
हूँ.
I'll tell you the difference. It is the intensity. So if I forget your name once and I somehow bring back the name into my mind, that's not dementia. That is forgetfulness. If I don't get the right word once in a while, that's not dementia. If I forget the right which account from which to give the money, that is not dementia. Dementia happens like certain serious things. Like, for example, I don't recollect your name for the next 1 week. That will be dementia. That will be, or I don't recollect where I've kept the keys for the next 1 week. Or I forget one of my aunt's name or my child's name. Or I forget where my house is. Okay. That would be a harbinger or a beginning of a dementia. Okay. That one needs to be investigated in detail.
Okay. It's like I've noticed with some people, they drive every day from point A to point B. Suppose one day the driver is not there. They are unable to drive from that point A to point B. They're unable to do that. Is it because they shut that part of the brain that हमको करने की जरूरत नहीं है?
Yes.
Or is it dementia?
No, that's not dementia. That you can't call it, because that's a procedural kind of a memory. Like I forget about the route, which route to take if the driver is driving. If I have to drive myself, it will be a big hurdle for me. So that I will not say. But if he can't, after driving for 1 month, suddenly he says, I can't drive anymore. He's confused. Instead of going east, he goes west. That would require investigation.
Okay. There are some people who, I don't know if, the term for it, suddenly are unable to write with one hand. They say, "Hum likh nahi sakte hain. I can type, I can pick up things, but I can't write." What is that syndrome called?
So let me clarify this part. So if you are not able to write, you will, for example, with your right hand, if you are a right-handed person, then you will think that there is a problem with your left brain. That should be investigated. Now, there can be reasons in the brain, there can be reasons in the hand. Now, for example, the moment you take a pen and your hand starts shaking, that is what we call as a writer's cramp. That's a local problem. Local problem in the sense that the brain is not giving the correct signals and therefore the hand muscles are not appropriately working. That will be called a writer's cramp. Now, that is a different, you can't write then also. And if you have a small stroke or you have a small lesion or if you have a hematoma or a blood collection in your brain, then also you can't write. So this requires investigation.
Okay.
Merely
Go
not
to
able
the doctor.
Go to a doctor. You can't handle it yourself.
Okay. Does that golden rule, or does that rule apply still of the golden hour?
Yes, if it happens suddenly, you must go within that 4.5 hours or to the...
Why is it called the golden hour or golden whatever?
Oh, because what we have seen over a period of time, initially it was 3 hours, then it has been extended to 4.5 hours, and it may get extended to 6 hours or 24 hours. We have seen that when we do this thrombolysis, it works well and less complications. The longer that we do, the complications increase and the effectivity is reduced. That is the reason why it's called the golden hour.
Okay. Docs, some of these frequently asked questions which we have for you, do we really use only 10% of our brain?
That's not true. I mean, it all depends. It all depends on what kind of functioning we are doing. Right now, I'm using, I think, 70% of my brain at the moment.
Like
when I'm relaxing and I'm watching a music, maybe I'm using just 10% of my brain. I don't think there is something like this.
Okay. But one has often heard, like, oh, why is this person? I would say, science has not figured out so much.
Even
of
when you are using 10% of your output, there's a hell of a lot of things are involved. There's a coordination. See, your vision, then your understanding, then your comprehension, then processing it, and then bringing out the information in a jiffy. So I don't think this is true.
Okay.
In the real sense.
Okay. Coffee.
It's a double-edged weapon.
Oh.
It stimulates well.
Okay.
It can cause migraine and it can take away migraine.
Okay. But I'll tell you honestly, I mean, I have migraine too. But coffee makes me alert.
It does. It's a very good stimulant. It's a very good stimulant.
How harmful is it? Okay, it causes acidity and stuff like that. That I get. That it causes stomach-related issues if consumed more than that. But for the brain?
No, I will not say directly benefits the brain, but it can cause a stimulation of the brain and which makes you alert under tiring conditions.
Yeah.
And you process well. You understand well, you comprehend well. So there's no really harm in taking coffee.
Thank you. I hope my family is watching this. Next, can we train our brain to have better memory?
That's true. For example, I read what I've written now. I will forget after 3 days. But if I read it 4 times, 5 times, I will have a better memory. See, short-term memory is stored in one place. Long-term memory, same memory, when we want to convert into long-term memory, you have to repeat it again and again. Then it gets stored as a protein across the brain.
Okay. So वो जो रट्टा मारने का
Yes, it has got sense.
Okay.
It's not just like that.
Okay. So, but tell
there
me
are some
thing.
prodigies who can remember things by reading once. They are brilliant people, but majority of the people need to read it 3 times, 4 times, and then it becomes the part of the brain. Or if you use it, you read, write, it improves.
Correct.
You make notes, then you remember better, isn't it?
Yes. I mean, I've always done that. I keep notes.
We all do it.
No, there are some people who don't. I mean, who can read a book and then just recite poetry.
They are a different class. They're a different class apart.
Blessed.
I'm talking of people, ordinary people like me.
Why is it that you had this, I don't know what memory issues which are now, we could remember phone numbers, now we can't remember phone numbers.
So because we are not using that part. We are not using it. Earlier we had to use it. So if you don't use it, it'll fade away. See, if I don't see you for next 20 years, your name may fade away from me and you vice versa. Okay. But if I see you regularly, I'll remember. It's as simple as that.
Okay, it's not a defect.
No, it's not a defect, not at all.
But you see little children who know how to use the cell phone immediately. They know left swipe, right swipe. They know how to do that.
That's a procedural memory. Like driving a car. You don't think, Acha, now I'll have to put this, now I'll have to do this. It automatically in your brain. You know how to do
Does it
it.
dull with age? What happens?
Yeah, obviously. Your neurons die every day, your neurons are dying. So obviously the capacity, the RAM, if I may use the word, is becoming less and less.
Okay. So how does one keep it? How does one increase it? Or
Repetition, puzzles. Like, for example,
Sudoku.
training, Sudoku, puzzles. You have to stimulate your brain. You have to read, you have to write, you have to use your brain. If you don't use your brain, obviously it will fade away. The memories which are there in it will fade away.
So as we grow older, it's like I've noticed, we were saying, I can't use the remote. Don't buy me this complicated phone. I can't use it. Or when we are with the thing, laptop, ye theek karke de do. You ask people to do it. And increasingly in India, it is there. But when you go to the West, you'll see that, people in their 60s and 70s do everything on their own because they don't have house help.
Correct. So it is a necessity. Necessity is the mother of invention. So when you are going to do something again and again, you'll learn it. Like somebody teaches you how to use this mobile phone, you will come to know how to send an email from a mobile phone. Now, it's fairly complicated, but if you teach somebody who's 95 years old and with normal cognition, will be able to do it. But it requires teaching. But there's an inherent resistance to do it. That is different.
Yeah.
That's an emotional, social issue.
So as we age, we should pick up more.
Absolutely. We should continue to train ourselves, continue to read, continue to listen to music, continue to see family albums. Then
Why
only
music?
Music will soothe you, will calm you down.
It's one of the things
it's very, very...
for stimulating the brain.
Yes.
Okay. Interesting. Can brain cells grow back once they die?
Never. This is the saddest part. So if a stroke happens, a particular part of the brain is dead, it remains dead. But having said this, I will talk of something very interesting called neuroplasticity. Neuroplasticity is like the adjoining brain cells or the opposite side. They relearn the processes which were being subserved by their dead cells. It's a long drawn process, therefore you have to stimulate the brain. You must have noticed that people who forget to speak after a stroke, they again start speaking. Not that the brain cells which are dead are activated. It is the surrounding brain cells and the opposite brain cells which take up the function. That is the beauty of the brain, that it can learn new functions. But it is difficult. Like it's telling a plumber to become an electrician. Overnight it will not happen.
Yeah.
It will take a lot of time to happen.
And they learn new things.
You relearn things, but not by the cells which are dead. Those are gone forever. So therefore we try to salvage the brain by this stroke. When stroke happens, brain cells die by the million every minute. We want to salvage it, and that is precisely why the person should reach the hospital, get the stroke treatment done immediately. That is the reason. So we salvage the number of brain cells that we can.
Okay. Next, is photographic memory real or a myth?
No, I don't have much information on this, but I feel what you see, you are able to recollect better than what you read or what you hear. Because photography memory is definitely better memory. I can tell you from personal experience. I remember your face, but I may forget your name. So I think this is not a myth, it is a reality.
Okay.
Exact mechanism, we'll have to read.
And there is dissonance sometimes when you can't...
you can't recollect the name, but you say, I've seen him. मैंने देखा इसको पहले.
And it's very frustrating when you can't.
And you pretend then somehow to find out his name.
So the brain is relearning that part all the time.
Yes.
It is important for us to keep giving impetus
Absolutely.
to the brain.
Absolutely. All the time.
Okay.
The brain requires stimulation.
So aging process...
the aging process of the inability to remember things can be processed, can be stimulated by reading, writing, relearning. All this can happen.
Like climbing steps. As people age, I've noticed that if they don't live on a first floor, second floor, whatever, and now almost all societies have lifts. So climbing stairs is also something that people are not doing anymore.
That's sad. That's sad because that is a part of inherent exercise.
Yeah.
It'll help you. It'll boost your blood flow.
Coordination.
And your muscle power will increase. So one should walk as much as you can. Walking and rising and going up the staircase is a very helpful exercise.
Okay. Can dreams reveal anything about brain health? This I think Naman has inserted. Can dreams reveal anything about brain
I
health?
wish I could say more about this. I don't have much information. I can tell something very interesting which family members should know. There is a type of Parkinsonism where or Parkinson's or degenerative disease where people speak loud at night. They make noises. They can even attack their partners.
Oh.
Yes, that is called RBD. REM. REM is rapid eye movement behavioral disorder. So this could be the harbinger of a neurodegenerative disease like a dementia or a Parkinsonism where you start talking loudly at night, talk gibberish and become violent to the extent that you can strangle your partner or try to strangle your partner. This is RBD, and if this happens in somebody, one should look out for a neurodegenerative disorders like an Alzheimer's or a diffuse Lewy body disease, something like that. One should look into this.
So, okay, several questions.
If this happens, one should be careful.
Why does it happen?
Really, we don't know the reasons for it, but basically it is a degeneration which happens in the brain and which causes this disruption in the neural circuits.
What's the difference between dementia and Alzheimer's?
So dementia is the mother of generic name. All kinds where you have memory losses are called dementia. Alzheimer's disease is a particular specific type of dementia.
Okay.
There are other forms of dementia. Like?
And it's not reversible, either dementia
No.
or Alzheimer's.
Alzheimer's has got a particular type of mechanism. There basically abnormal proteins are deposited in between the cells, so the cells don't talk to each other. The neural circuits are broken. And we have now drugs to break those proteins. We are just on the anvil of improving them. They're very costly, not very effective, but new drugs have come in which can break these plaques, these amyloid plaques.
Okay.
Okay, tau proteins and amyloid plaques can disrupt the neural circuitry. Wherein this is the way you talk. For example, there's a lot of processing required. For example, you ask me a question, I understand, comprehend, and I respond. Now that circuit is broken by the deposition of abnormal protein, which we call as amyloid protein, or this tau proteins, amyloid plaques actually. So we have drugs now to that. We just started developing drugs to that.
See, there are many people who will say that, oh, I tell my mother that I'm traveling on Tuesday, I'm coming back on Thursday. She will think I'm going on Thursday and coming on Tuesday. And बार-बार वही सवाल पूछते रहते हैं. So this is something that it happens for many people.
Could be the beginning of a dementia. One needs investigation.
Okay.
So you can do a lot of, you can do some psychological tests. There are different lobes like the frontal lobe, the temporal lobe. We have certain bedside tests by which we can say this lobe is affected more than the other lobe. I'll give an example. In Alzheimer's disease, what happens? You lose your language functions. Your vocabulary shrinks considerably. Like if I have to describe you, I will use some 10 lines. But if I have to tell you, smart lady,
Yeah.
it will just come down. There are other dementias where your behavior changes. You become aggressive, angry, you become incontinent here and there, you change your clothes here and there. That's like a frontotemporal dementia where you're very aggressive. So different dementias manifest differently depending from which part of the brain is affected most.
Very interesting because many years ago, Doc, I think 7-8 years ago, I wrote an article on this and I got so much of response on that article simply because it was about dealing with dementia, Alzheimer's in my grandmother. She became a completely different personality. She started singing Hindi songs which she had never sung. And she would sing and none of us had ever heard her singing. And she started singing that and then we figured out that what is happening is she's going back in her mind into
Right.
her youth and where she liked listening to Hindi songs, but because it was not appropriate in her youth, it was considered
Absolutely.
bad.
Absolutely.
So she was just storing it in some part of her brain, which in her 90s started coming out.
Correct.
And she started singing and smiling and doing certain things which were completely alien. We had never seen her doing that.
So the inhibitions are gone. The inhibitions are gone. And this being an old memory, it is stored well across the brain. So that is coming out now. Now, what is inhibition? You're a newlywed girl, you will keep quiet, you will not talk much. But by the time you're 90 years, then all that is gone. So something like that. So in dementia, this can happen.
And tell me, since you are the brain guy, why is it that in older people they have older memories very clear, but newer ones they are not able to process?
So I think I just mentioned that also. A fresh memory, for example, some question you asked me, like this question, I'll remember this is called instant memory. Okay, recent memory, instant memory. This is stored in a place called hippocampus. Okay. Hippocampus, which is a part of the temporal lobe.
Okay.
If I don't repeat this, it'll disappear. But if I repeat the same question again and again and again, it'll get encoded as a protein in different parts of the brain. So recall is easier. So the registration has to be there. Then recall is happening.
Okay. Also, registration, sometimes what happens is like if we are watching the news or whatever, it's registering at that moment. And then by next day, if we are not, we don't bring that thing back into our conscious thinking, that's gone. Like so many times we're watching a movie, we won't even remember the names or who acted in it the next day.
It's because you're not focused on it. Your subconscious mind is going on with other things. You're just watching the movie very casually. You're not concentrating it.
Okay.
You're not focused on it.
Okay.
So unless it is registered well, you cannot recall it.
So recall, one should exercise one's brains for recall?
Yes, absolutely.
Okay.
And what is the way to stimulate your brain? You have to do your quizzes, you have to do your puzzles, you have to do your jigsaw, you have to read, you have to write, you have to color. You can play an instrument. Like if you don't play your guitar for a very long time, you will forget about it. But the moment you do it a little bit and you then recall it. Something like that.
How have modern machines like mobile phones or your iPads, children doing this all the time, how is it impacting?
So I'm glad that you have touched this topic. I want to tell you, mobile phones for a kid is a strict no. I may be very harsh, but I am mentioning that. It curtails his language acquisition.
Explain.
Language acquisition means the language which is spoken at home, he does not pick it up that much if he's all the time on the mobile. There are many disadvantages for a young boy or a young girl to look at the mobile. A, language acquisition. That means the language which is spoken at home is not acquired by him adequately. He suffers from language dysfunction. Then his social and emotional development is marred. Definitely it is, it is driven by what he sees as a cartoon or whatever he sees. It is driven by that. What is the social norm at home? Who is the elder person? Who is the younger person? All that development does not happen.
Really?
Yes, because he is concentrated on the mobile. So mobile is a strict no for children. If at all it has to be done, it should be with co-viewing. The parent must be there. Parent must be sitting with the child and explaining everything that is required. And you have to have boundaries. Maybe 1 hour, half an hour, that's okay. It should be an entertainment. It should not be a substitute to mothering or parenting.
Okay.
That is what is happening to keep the child, engaged, busy. We tell them, okay, see a cartoon or see a movie or things like that, which is very, very dangerous and should not be done.
So there are many who say that this is overstimulation of the brain. So explain this term for me.
So overstimulation, he is stimulating in a particular way. I want him to be stimulated by knowing this is the grandmother, this is the grandfather, this is the puja room, this is play, this is your friend, this is a game, this is food. He's just doing it because it has to be done as a physiological means. But his brain is focused and concentrated there, so he doesn't develop the other things, faculties which are required to be developed.
Yeah.
For overall development. So his social, emotional development does not happen. And language functions suffer. He doesn't acquire, see, you and I talk so much, he picks up.
Yeah.
But that cartoon just speaks nonsense.
True. Because I remember in the US, I was with a family friend and their child was on the table. It was a 7 or 8 year old kid. Not very young. And Indian food में ना वो clove आ गया. Long.
अच्छा.
हाँ, clove था, वो long था. So he was seeing it for the first time probably or whatever. So he said, "What is this?" So I said, "It's clove. Like you've not seen this." And so the mother said that no. So I said it's used in Indian food quite a bit, and so he says, "So where do you get this?" So she says, "It grows in Costco." I said, grows in Costco? Ye kya bol rahi hai? So I said, it's a spice, so it
Correct.
grows in the farms. And so she said, oh my God, I thought you get it in Costco. I was like, they have never been to a farm, they have never been to the fields and seen spices grow. So the mother thought it's in Costco, the child has never seen
Correct.
spices growing. So I think Indian families, maybe it is necessary. I've seen now celebrities taking their children to actual farms and villages to understand this.
It's very important. It's very, very important that you get to know the entire 360 degrees around you. See, how will you develop? How does a small child develop? He develops by seeing what is around. If he just sees those ducks and those rabbit and other things only on the video, how will he grow?
Yeah.
And in addition to this, it can cause eye problems because all the time he's focused like this. So his distant vision is affected. They get high myopia.
Okay. So this overstimulation is the wrong stimulation, right?
Absolutely. It is wrong to the extent that it should be banned.
Okay. And also the fidgety attitude that
Happens part of this.
So the brain is sending signal to constantly do something.
Yeah, they're restless. Then they don't know how to relax. So if you don't relax, you can. Adult ADHD, I see it so often.
Adult ADHD.
Yes. I see it so often. I have an oncosurgeon colleague. He's all the time jittery. I gave him the drug and he's much better now.
That shaking of the leg, which is considered so common, कि हाँ ये होता है. Just I have to physically tell people, stop, like, don't stop doing this.
So there's a condition called restless leg syndrome. But this particularly disturbs people when they are sleeping. It doesn't happen when they're walking. But there's a strong urge to move your legs when you're lying down. That is called restless leg syndrome. It happens due to two conditions. When you're low, your iron levels in the body are low. That happens. And the other condition which happens is genetic. So if it is low iron, you can correct it very easily.
Okay.
And you don't have to give a medicine. But if it is genetic, it's difficult. Now I'll tell you a very interesting family. He's a pilot with one of the airlines. He has restless leg syndrome. His wife, who has of course come from another family, has restless leg syndrome. And his two children also have restless leg syndrome. All four in the bed, they move their feet around the clock.
Oh, gosh.
So I had to give them, and they have a genetic part. So I gave them medicine and they're much better.
But it's also a behavioral thing, right?
No, not really.
No?
Not really.
Okay.
Restless leg syndrome has very little to do with behavior. It is more to do with these two things which I mentioned. Low
But
iron.
it's also this erratic
That is a
restlessness.
that is restlessness. But restless leg syndrome is a.
But you can tell your brain, na, ki stop doing that.
You can stop it.
Ballpoint pen, tak, 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 tak.
You can stop it, but it comes again.
It comes
The
again.
urge. There's an urge. It gives relief when you move your legs like this.
It's also like some people cannot type without a cigarette in their hand, or they can't.
They can't think also without a
They can't
cigarette.
think without a cigarette.
Old timers.
So
I know.
what is it? Is it
I think
actually your brain telling you?
Yeah. I think that's an addiction. There's an addiction. Unless you take it, you don't feel comfortable. Nicotine is very addictive.
Yeah.
So-
Can you get rid of the ill effects of that nicotine?
Lot of effort is required. There are certain drugs which have come in which can take you off the nicotine. There are drugs for alcohol addiction also, but people don't take it. That is a problem.
But they say that even 10 years, 15 years after stopping from smoking, people can still get strokes.
See, the average waiting time for it to have the same risk factor as a person who doesn't smoke is 10 years. If you stop smoking today, your risk capability or your risk becomes the same as a person who doesn't smoke after 10 years. Okay. So you have to wait for 10 years for the risk factor to become zero.
What is brain food? People keep saying ki ab ye wali pudiya khao, it's good for the brains.
So the good brain food would be, for example, dark chocolate has got flavonoids that helps the brain. How? We don't know. All the vitamin B, they help the brain. Thiamine helps the brain. So vitamin E can also probably to some extent help the brain. So these are the good vitamins.
Other vitamin E is for complexion.
Yeah, but it also can help the brain a little bit. Okay. So these are but basically you have to eat your vegetables and your dal and
So
sabji.
you don't say supplements, you don't advise supplements.
You can take supplements if you're short of, say, vitamin B12, you should take. If you're short of vitamin B9, magnesium has now emerged as one of the food
That
items.
this is the new thing now.
Yeah, everywhere it is all magnesium.
Yeah. So
And magnesium can be also used for treating migraine. This is the latest thing which has come up.
yeah. So for this, do the blood test and then get to know.
Yeah, yeah.
But only if it's a deficiency should you take
I
supplements?
think so. Otherwise, additionally, magnesium is difficult to measure, but you can measure it.
Okay.
I mean, it's costly to measure it, but you can take it. Everyone is taking magnesium nowadays.
Okay. Let me get on to policy matters. Is the government doing enough? Should we have more spent on research on neuroscience? Should we have more awareness? Should the government do something about awareness about neurological issues? What is needed at a policy level in our country?
See, at a policy level, my submission would be that we need more awareness of the neurological conditions. You will be surprised to know, deep down in the hinterlands, epilepsy is still being treated by jhadpuk, whereas it is a easily treatable disorder. Quite some time back, epilepsy was a reason for giving divorce, whereas it is easily treatable. Stroke management is done by putting turmeric and all that in the villages. No, that has to be stopped. That is where the policy intervention is required. And the second thing which I wanted, because the cost of treatment is so high, there has to be a cheaper, more meaningful health insurance policies for the individual. I think that is what is required, so that they can afford the modern treatment.
Yeah.
There's no reason why somebody who is from a village cannot take a thrombolysis. We don't have adequate medical evacuation systems. These are the policy decisions that we have to take. Correct medical evacuation for people who are critically ill, deeper penetration of the insurance, medical insurance, and awareness. I think these three things will make a lot of difference.
Yeah, insurance is like, that's another big issue where it's not acceptable. They say aapne bataya nahi tha. People don't know that they had a precondition because they don't do annual tests.
Correct.
Those kind of things are there which happens.
And it can be done. You know, the penetration of 140 billion, 1.4 billion people. It's not easy to insure everybody.
Yeah.
But the insurance penetration is very much required. There are so many countries who have got universal insurance coverage.
Yeah.
We need to at least adopt that kind of policy. Because our government hospitals are overwhelmed with patients. There are
Yeah.
too many of them. You can't do it. You can't do justice to them.
Yeah.
And everyone gravitates to the bigger cities for treatment, which they need not come. For cold and cough, they need not come. But the people do come, still come.
Yeah. Is that frustrating for you as a physician?
Everyone, it is frustrating because, for example, our national institutes, they are treating patients who need not come there. Normal epilepsy can be treated at a district hospital, but somehow they gravitate towards the bigger hospitals.
Okay. You know, I've had people who have come on the show and politicians also who say that medical thing, आजकल तो सिर्फ डॉक्टर जो है सिर्फ पैसे बनाने में लगे हुए हैं and things like that. You guys need a lot of PR work, which is, let me tell you, just like journalists too, because जैसे पहले सर्विस हुआ करता था medical profession, अब नहीं है, अब it has become कारोबार. How do you deal with that, doc?
So this allegation will always be there, and unfortunately we can't employ lobbyists like the government does. So we can't have a lobbyist to protest about this, but this is absolutely untrue. If it happens, I'm sure it happens, it must be 10, 15, 20%. 80% of us do our work very sincerely, devotedly, and with all gusto. Nobody is into karobar. You know, to see 40 patients in a day and sincerely is not easy.
Yeah.
It is not easy. And I mean, I'm not trying to say about myself. I skip my lunch so many times.
Yeah.
Because there's no time for having lunch. It's just not there. Why should I miss my lunch? I do it for everybody. I mean, irrespective of his economic or other background. So I don't think this is true. 10, 20% may be there. Karobar, I can't deny that. But majority of the doctors are very clean and they work very sincerely and they worked very hard to reach the place where they have reached.
Yeah.
It's very
Especially
difficult.
you know, people who travel abroad, especially in Europe and in America, they should know that you can't, like you can call your doctor on a Saturday or a Sunday here. You can call him at midnight. You can call her at midnight. You can just, reach your doctor at home. There's no way you can do that in the US or in UK.
So they have a great service. Their population is much less. Probably they can afford to do it. And here you go to the emergency, you are attended immediately. Except maybe because of sheer number, you may not be attended, but you go to one of the hospitals, you are attended immediately. Much faster than what is being done in the advanced countries. So I think the medical service, that's why we are getting so many patients from international patients.
Yeah.
We get the CIS countries patients, we get the entire African and to some extent some of the Middle East countries coming to us.
Why did you stay back in India? Tell me one thing. Because your generation of doctors, so many got fabulous offers from the West. Why did you
So
not
let
go?
me make this correction here. I'm an ex-army officer, so obviously it is very natural for me to integrate into the system. I don't think I missed anything, except maybe a better quality of life, but that is all very, very comparable and relative. So I have had a very good tenure. I have seen the corporate world, I have seen the government machinery also. Very satisfying service I have got. I have no complaints. I don't think I would have missed anything by being overseas.
Because those guys mint money, you don't.
See, money is not the ultimate aim in life. Ultimate aim in life is job satisfaction. I have immense job satisfaction, and that gives me a lot of happiness and pleasure.
What was it like in R&R and now here?
See, R&R is a different experience. This is a different experience. It is an excellent hospital. It is the apex hospital of the armed forces. And you name it and you can get it. You are seeing a different set of patients. Of course, what has happened is medicine has improved quite a bit. Investigations have improved. Those things are available here, but they are very costly. Unless you are insured, you pay through your nose. So that's the difference. There I could ask for it by the right. Here I have to see his pockets, then only can ask for an investigation. So there has been an improvement in the services which are available.
Okay. Doc, I want to ask you about the role of AI in diagnosing issues with regard to neurological disorders. I've done a podcast before on AI and cardio, but I want to ask you about neurology also. How much is it being used?
So it is not being used much, but it is going to be having a potential to be used quite a bit. So AI is going to improve our algorithms for managing patients. For example, in investigational diagnosis, it is going to be a big change, game changer. It will improve our diagnostics. For example, if you analyze 1 lakh patients of 1 lakh CT scans, you will get a different information rather than getting it from 10. So that is going to improve our algorithms. The other things which are going to have is implants. Like we are looking at an exoskeleton which will make people who are paralyzed below the waist to walk. Or giving him a robotic arm. He can write, read with a robotic arm even if it's paralyzed. I think those are the changes that I'm looking in the future. A bionic eye, somebody who's blind and he can have a camera or a chip inserted or a memory chip inserted so that he can remember things. So I think those
Seriously?
This is a futuristic,
Okay.
but this is work to be done.
Okay.
And progress which can happen over a period of time. I mean, maybe beyond me, this will happen. But this is what I look at in future.
How much of robotics is used in your profession?
So-
in the sense, like when surgeries and all happen, how much is it used in neurology?
Currently, not much,
Okay.
but there is ample scope. Those robotics are being developed where it can do a brain surgery, spinal surgery. I think they will have a place. They will have a meaningful place, and they are going to make a lot of difference. More precision will happen. But those are under development.
Okay. Because it is being used in ortho and the others
Yes,
a lot.
ortho, urology, they are being
Okay.
used. But it is a process in development. I think they will have their place
Okay.
in days to come.
How much of your medical practice is still meeting your patient and seeing for yourself and figuring out what's wrong, and how much of it is your dependence on AI increasing now?
So there is no clinical examination without the patient. I think I will call it 90%. The history, the physical examination, that gives me most of the information that I want. 10% to 20%, maximum 20%, I need to fine tune that diagnosis, which I make clinically. So I need robotics, or you can say I can use the AI, or I use the diagnostics only about 20-25%. 70 to 75% I make the diagnosis by history and by clinical examination. That is how I have been trained. At least my generation of neurologists were trained like that. So we still depend on that. And I try to, I have also got students under me. I also try to teach them that, because that is the basic. If you miss that, you can go wrong, completely
There's
wrong.
another thing which happens is the resistance to go and see a specialist is that अरे इनके पास जाएंगे ये तो सुपर स्पेशलिस्ट है ये 10 टेस्ट बोलेंगे मेरा बिल आएगा 10,000 से कम और ये हॉस्पिटल्स जो हैं बिना टेस्ट किए तो करेंगे नहीं तो क्लिनिकल एग्जामिनेशन इज ओनली द फर्स्ट स्टेप टुवर्ड्स 10 different tests and another 10,000 rupees of tests.
I accept this charge, but there is no way out. See, today the refinement of diagnosis has come such a long way. For example, there are mimics. There are many mimics which we need to. For example, Parkinson's disease. You can clinically diagnose. The moment the patient enters, you can diagnose. But supposing there is a patient who says, "Acha, kuch aur ho sakta hai." Now, when he says that, you have to do a F-DOPA scan.
What's that?
That's a scan which shows the dopamine is less in a particular part of the brain.
Okay.
So I'm just giving an example. That's a costly test.
Huh.
As of today, it is a costly test. If the patient doubts it, कुछ और तो नहीं है, कुछ और हो सकता है. So how do you prove that? Then you have to do this test. There are certain conditions in which it is mandatory to do it. For example, motor neuron disease, which the cells which give the nerves die. You have to do an EMG. You can't say, I will say this. Because, you are giving a death sentence to that patient once you say ALS.
So tests absolutely necessary. This thing is when the doctor says get a test done if you don't do it, then you're risking your life. It's absolutely
Even it is not fair to the patient also if you don't do certain
Correct.
tests. In certain conditions, tests must be done. Like for example, somebody is having headache, persistent headache, severe headache. If you don't do a CT scan, it's dangerous.
Yeah.
You must do a CT scan. If somebody has a stroke, you don't do a CT or an MRI, it's not fair to the patient.
Thank you, Doc, for spending this time and explaining to us. And I hope our viewers and listeners take all the suggestions and all the things that Doc has said. Eat sensibly, eat mindfully, sleep, get your rest, work-life balance. Not a joke. Take it seriously. Thank you so much, Doc. Thank you. Thank you for watching or listening to this edition of the NI Podcast with Smita Prakash. Do like or subscribe on whichever channel you have seen this or heard this. Namaste. Jai Hind. This episode is powered by easemytrip.com. Click here to watch the previous episodes.